Welcome to the webinar, The Next Era of Medical Devices and Diagnostic Innovation. My name is Josh Haslam. I'm a Senior Director here at Lux Research, and I'll be presenting today's session alongside my colleague, Nardev Ramanathan, Associate Research Director here at Lux Research. Now, throughout the webinar, you can type any questions you have into the questions box on your screen, and time permitting, we'll answer questions. If your question doesn't get answered, though, please don't hesitate to email it to questions@luxresearchinc.com, and we'll respond. Now, if at any point during this webinar you have a technical difficulty, such as a frozen screen, best thing you can do is simply refresh your browser and check that your internet connection is strong. So with that, I want to jump right into the webinar today. And as we said, today we're talking about the next era of medical devices and diagnostics. And we're really excited about this space, for one, because Lux has recently launched a new service, Medical Devices and Diagnostics for Innovation Leaders. And the reality is Lux has been looking into this space for quite some time. We have covered materials in it. We've covered a lot of sensors and innovations. And very often our clients have asked a lot of questions on this space, but we haven't had a dedicated service. However, as you'll see here, with kind of how things have shifted recently with respect to market conditions in the medical device and diagnostic space, what we see in this is growth through innovation is requisite. So on the right, you have the Lux Tech Signal. This is a summary of patents, trends in papers, partnerships, funding, and what it ends up being and providing is a leading indicator of innovation momentum. So below you have a medical devices and diagnostics Lux Tech Signal. And you can see clearly it shows, for instance, the COVID innovation boom that we saw around 2020, 2019. We also, however, as I said, this is a leading indicator, see the post-COVID boom. And this is one of the important signals, right? We have a lot going on here with a lot of companies looking for emerging growth opportunities. If you look at medical device companies right now, and you look at what is actually driving growth through those companies, we see that for companies that are growing anywhere from 5 to 30% year over year right now in this space, it's innovations that are driving their growth. It's not finding new markets. It is actual innovations that are driving those. And beyond that, we also see that a lot of companies outside of the medical device and diagnostics industry are looking for adjacencies to revitalize growth. So a good example of that is chemicals and materials companies that are maybe having challenges growing in other markets, for instance, different opportunities in synthetic biology tied to recycling. And they're looking for new opportunities to grow that have much stronger growth, but growth that's also tied to sort of other features. For instance, right now we see that governments are prioritizing health innovation, and they're doing it for a couple reasons. One, we have quality care being challenged by demand. This is incredibly challenging across the globe. We have, of course, the promise of AI and its hope to reduce workforce burden and strain as we try to also protect quality within the care system. And of course, lastly, cost of care. How do we decrease financial burden on the consumer while also delivering them better and more consistent care independent of their economic status? And so all these things are coming together, and we have innovation really sitting at the heart of this today and pushing that industry faster than ever before, as we can see in the tech signal. So, with that, what we're going to do today is do three things. First, we're going to talk about our unbiased client-centric methodology to uncover the priorities for the next era of innovation for medical device and diagnostics. We're also then going to talk through those client priorities and provide you examples, what we think about them, and set the stage for understanding then what Lux will be doing in the future to help you understand and capitalize on that next era of medical devices and diagnostics. So with that, how did we do this? How did we come up with this area as Lux is endeavoring to work in this area? Well, first and foremost, as I said, we took a customer-centric approach. We looked at annual reports first, of course, of the leading industries that were going to be covered. So the medical device companies of the world, the healthcare organizations of the world, whether that's a hospital or a highly innovative healthcare organization. the chemicals and materials companies, as well as the life science companies, right? So we really looked broadly across these, but that wasn't it. We also looked at the questions that we've been answered. So Lux has a community of innovators across these spaces as well, and we have received a lot of questions on these types of topics. And we also cover over 1,000 innovation initiatives that align directly and indirectly to the medical device and diagnostics space. So what we can do is analyze all that information together to break down and understand themes, and then use our ongoing perspectives as well as interviews with key clients and prospects to understand more about this space. What we then what that resulted in is uncovering 5 key priorities. And so these priorities, therefore, are grounded in data, grounded in understanding of where and how companies are looking to innovate for growth, what those bottlenecks are, what those challenges are, and use that alongside our experience understanding hundreds of technologies that Lux covers today to really break those down into what matters for this industry. And so where we settled were these 5. Starting on the top, building precision treatment and care. Innovating point of care solutions is number 2. Streamlining laboratory workflows was the 3rd priority we uncovered. Healthcare operational excellence was the 4th, and of course, policy and regulations. Now, Lux covers policy regulations always as we think about technologies. It's one of the most important bottlenecks and opportunities for innovation, and therefore pervades, as well as being its own priority, pervades all of these other priorities because policy interacts with them in very different and unique ways. So with this in mind, what we're now going to do is dive into each of these different priorities, and I'm going to pass it off to my colleague Nardev in a second to do that. But before I do, it's important to note also how important are these 2 different organizations. So if we talk about those 4 groups that we looked at, that I brought up before, the medical device companies, the healthcare organizations, chemicals and materials companies, and life science companies, we see, again, as far as technology goes, there's 2 clear drivers. Right? We have building precision treatment and care and innovate point of care solutions. Those were consistently, most commonly targeted for growth through innovation across this. Streamlined laboratory workflows was very niche and explicit maybe for life science companies. Healthcare operational excellence was also a broad area, but less more consistent across all of these areas, much more focused on the healthcare companies and medical device companies in the world. But again, 68%. And then again, as I brought up before, policy and regulations kind of pervaded everything. This is the key organizer, opportunity maker right now for medical devices and diagnostics. And just as a heads up, we will have a report coming out in the short term on the current state of policies, particularly for AI, when we think about the medical device and diagnostics space. So this hopefully also allows you to orient these as far as their relative importance to growth through innovation. Now, as I said, with that, I want to pass it off to my colleague Nardev to jump in and give you a little bit more details about what we mean when we say each of these priorities, what do different facets of that look like, and how to understand them a little bit better. So pass it to Nardev.
All right. Thank you very much, Josh. And without further ado, let's jump to the first big theme, that is building precision treatment and care. Now, healthcare is moving away from a one-size-fits-all approach towards more interventions and treatments that are more personalized, more targeted, and more connected to real-time data. The goal really is for better outcomes with fewer adverse events, shorter recovery times, and more tailored patient journeys. And as Josh mentioned, we regularly get questions from the network of innovators that we connect with, and some of the questions we get are, how are advanced algorithms enhancing early detection and decision support? Or how are digital therapeutics, sensors, and even robotic platforms enabling measurable recovery outcomes? Now, one of my favorite real-world examples that tackles this is from the NHS, or the National Health Services in the United Kingdom. They rolled out an AI tool across 107 stroke centers. What does it do? It analyzes CT scans in under a minute. The impact? Treatment times were cut nearly in half, and the rate of patients recovering with minimal or no disability tripled. Tripled. So that's not incremental, that's transformational. And this is the type of precision that's becoming expected, not just exceptional. The second theme here is called Innovate Point of Care Solutions. And it is really about the rise of point of care and at-home diagnostics. Hospitals and clinics are no longer the default touch points for care. Patients want faster answers. Clinicians want to intervene earlier, and health systems want to reduce unnecessary admissions and readmissions. And so typical questions we get here revolve around how novel sensors and materials are improving the accuracy of monitoring outside clinical setting. And here we have a great example as well. Ireland's University Hospital in Galway, they basically implanted a minimally invasive heart failure sensor that transmits daily fluid level data to clinicians. Now, with that data, clinicians can intervene up to 2 weeks before the symptoms show up. Now, that's pretty incredible, right? It flips the entire care paradigm from reactive to proactive. Now, point of care also isn't just about convenience. It's about creating a new rhythm of care, continuous, anticipatory, and deeply integrated into everyday life. Now we come to the third priority here, which is healthcare operational excellence. And I know that sounds like a dry buzzword, but really it's not. Right now, it's basically a survival strategy for many healthcare systems around the world. Now, staffing shortages are real. Rising complexity is real. We've seen how COVID-19 basically unmasked these issues, leading to major strain on global healthcare systems. Now, one estimate found staffing shortages cost US hospitals around $24 billion over the course of the pandemic. So transforming repetitive, resource-intensive tasks into more streamlined, technology-driven processes is really key to addressing this shortage. Naturally, the questions around this topic are about how robotics and other automation tools can reduce strain on staff and resources, as well as augment other healthcare processes. Now, one example here is the collaboration between Mayo Clinic, Cleveland Clinic, and Rush University Medical Center. They've deployed AI-driven supply chain systems with predictive analytics and robotic fulfillment. The results? Fewer stockouts, billions in waste avoided, and a shift from reactive procurement to more proactive logistics. Now, that's not back office improvement, it's actually strategic capacity building, if you think about it. Now, the fourth priority here is focused on streamlining laboratory workflows, right? These teams in the laboratories, they're absolutely overwhelmed with more samples, fewer staff, and typically tighter turnaround requirements as well, similar to what we saw in the healthcare systems earlier. Automation and workflow orchestration are no longer optional, but essential for industries across life sciences to pharmaceuticals and CDMOs. And naturally, the questions here are similar to what we saw with the previous priority as well, where industry players want to better understand how novel automation tools can truly enhance high throughput while maintaining quality and consistency. A good example that comes to mind here is Eppendorf's bio-based consumables. They replace up to 90% of fossil plastic with renewable materials while maintaining full performance, enabling labs to reduce tens of thousands of kilograms of plastic waste annually without altering workflow, without changing a single workflow step. Now, that's innovation that feels invisible, but it delivers significant impact while also being sustainable.
All right. So, Nardev he's laid out the the priorities we have, the question is, what do these mean as we begin to evaluate them, right? And look at them. First, we're going to do that by sub-industry. Then we'll also look at it by region. And so what I'm showing you here in the figure is an overview of priorities aligned to growth through innovation for, again, each of the priorities we've laid out: building precision treatment and care, innovating point of care solutions, streamlining laboratory workflows, and healthcare operational excellence, with the notion, again, that regulation really falls over all of these. And I will even share an example. So what I want to do is share examples now that show why these priorities continue to matter. So to start out, here's an example. Again, if we look across all the data here, we can see, for instance, that building precision treatment and care and innovate point of care solutions is important across all these spaces and all the different sub-industries that we have here. So an example, for instance, what's actually happening? How are clients and innovators actually moving in this space? Well, for precision treatment and care, we see that the digital transformation remains absolutely critical. So here's a pretty good example. We have Core Sound Imaging's acquisition of Ultralink. So what are these two companies? First and foremost, both are picture archiving and communication systems developers, right? So they were talking about storage, retrieval, management, sharing system for all the imagery, reports that are created. And these are important because they connect directly to electronic medical records systems, right? And they're trying to essentially provide that touch of personalization, access to information, and rapid communication that's necessary, right, as we move forward in a new information paradigm. So as we begin to see that, then why is this important? Well, it's important because the acquisition goes towards a system that is much more flexible than StudyCast, the system that Core Sound Imaging has, mainly because Ultralink provides this opportunity for a cloud-based system that can be made agile for a lot of new modalities, right? And as we think about the future of medical device and diagnostics, particularly as it pertains to growth of AI and its application to a lot of different tools, these types of solutions are going to be absolutely critical because we're going to need to be checking, validating, ensuring that information is correct and done quickly. So this type of acquisition goes hand in hand with how innovation's moving. And it's not a surprise also to think that some of these companies will begin to start to work directly with medical device companies and perhaps even may be acquired in the future. So a really important one to look out for. Now, on the other half, we see that, again, the other side of this was innovating point of care solutions. Now, typically when we think of innovating point of care solutions, we think about what is happening to the patient, the clinician as they're working. And there's a lot of innovation going on there, to be honest. But the one I wanted to highlight today in the name of time and to show how innovation is really driving new opportunities is this large and important acquisition by Thermo Fisher for Clarios. This is an $8.9 billion acquisition. And, we have Thermo Fisher, right, a leading life science, laboratory equipment, device company. And then Clario is a very different organization, right? Here's a company that is a clinical research partner, right? They specialize in application of AI to improve analysis. They've done that in over 600 different trials to date. And even more importantly, Clario can enable not only, in-person clinician trials, but also hybrid and fully virtual trials using a lot of different testing modalities. So what's this look like then, right? In the future, with this very large acquisition, we have a company that is an expert in developing devices and new testing modalities with a company that is now an expert in creating and evaluating AI opportunities, but doing it to test those, right? So providing that service. So this new service added on is absolutely important. For one, it's going to overcome a lot of the bottlenecks we see in clinical development of new testing modalities that are going to rely on AI, but it's also going to create a very large and important business. So this is a really important one to also follow, and likely we're going to see point of care become very important to the future of testing towards discovery and development, whether that's drugs or whether that's actual medical devices and diagnostics. So again, another very important opportunity and expansion of what it means to innovate point of care solutions. Now, again, we can look at it by sub-industry. We can also look at it at the geographic regional level. So as we see here, we can also see that regions have some unique differences. We see the Americas, again, with a focus on building precision treatment, innovating point of care, a little bit on healthcare operational excellence. We see something similar for APAC. These two are also slightly different in that we see a lot of medical devices and diagnostics focus in the Americas, more materials development in the APAC region, and EMEA is more of a balance, especially as they're working through policies to evaluate and develop clinical devices. So what are some good examples of what we can look here? So first off, I wanted to start with a hybrid, right? I talked about how briefly Americas tends to focus on medical devices, APAC on materials, but this is a hybrid. This is one where we see a little bit of both going on. So Medtronic being a US centric company and a company Nanoviz. So what do these two do? Well, Medtronic creates these peak cervical fusion systems. So they support correction and spinal procedures. So this device and system can be inserted. It gets inserted between the vertebral bodies and comes in numerous heights, very adaptable, right, to be used in surgery in a lot of different ways. The challenge, of course, is having that become fixated within the vertebral column. Now, that's where Nanoviz comes in, and this is where we see a lot of materials innovations providing help, right? In this particular case, we have a titanium nanotube surface that gets coated over this PEEK implant, and what it does is improve the bone healing process so you get better, stronger fixation for this implant. And why is this important, right? It's important because as we think about the future of precision treatment of care, as we think about even the future of point of care solutions, the ability to have implants that are fixed within that biological system is absolutely incredibly important, and where material innovation is moving forward. And this is going to be a very important part of our coverage, especially as I brought up, materials and chemicals companies are looking for opportunities to apply their capabilities to these new markets so that they can help care be better, but also grow. Now, second, on the other side, and something we haven't talked as much about yet is policy. Now, when we think about healthcare operational excellence, and particularly in Europe, we see that they've went through some pretty challenging times recently. We've had the EU-China medtech sort of trade conflict that happened. Essentially, EU's policies kind of created a bottleneck around medical devices and took some off the market, added some costs, and as a result, what do we have happen? Well, EU is now in the process, as we've seen a lot of different industries aligned to, for instance, sustainability as well as medical devices, becoming more market focused. And this is no different, as we said. So now we have industry groups really pushing hard for the EU to shift how they regulate in order to reduce this, improve market availability and reduce these bottlenecks. Because if you don't, again, competition is right there waiting at the door. So we really expect to see this happen a lot more in the medical devices space as innovation heats up, as different regions, different countries begin to prioritize innovation for growth, which is another signal I think we're seeing broadly. And so, as you think about this in the future, this is just one example of how policies moving forward to really change the game and continue to improve opportunities for growth through innovation in MDD. And we expect this to happen, again, much more broadly. And as I said before, NARDEV's going to be developing and completing a report on this topic in the short term. So, if you have questions, definitely reach out on this. We think it's a really interesting space. But, with that, what I want to do now is pass it back to NARDEV one final time to talk about what Lux has planned for the future as far as assessing these opportunities beyond just understanding the priorities that we've talked about today so far. So back to you, NARDEV.
Thanks a lot, Josh. And now I'll kind of wrap up with talking about how we can really capitalize on the next era for MDD, medical devices and diagnostics, and we call it MDD for short. So first of all, I think it's important to understand adjacencies for health. As companies look beyond their core offerings, adjacencies become really one of the strongest levers for growth. And the Lux Health Radar, which is a report that we've published, which clients have come to us a lot on to ask us how to leverage this framework, assesses opportunities across the continuum of care, the patient journey, and in fact, this has been used in the consumer version as well for the consumer-centric journey, but it can be leveraged for the patient journey as well. So it looks from being healthy all the way to severely diseased, as well as the different levels which it engages the individual, right? So, from the intrinsic factors like the genetics, the biology, to the lifestyle, nutrition, fitness regime, to environmental factors ranging from pollution, humidity, and so on, right? And so this takes a very, very comprehensive, holistic view at how to engage an individual, a consumer, or a patient. And there are two critical adjacency opportunities that emerge for the medical devices and diagnostics sector in particular. The first is platform adjacencies, right? Expanding from diagnostics into prevention and ongoing condition management. Now, this is where AI-driven early detection, continuous point-of-care sensing, and remote monitoring converge to reduce disease burden by shifting intervention earlier in health continuum. Now, we've covered a lot of this at Lux, through our coverage with diabetes management, for example. We've written a lot about how, Dexcom and Abbott have, moved further towards over-the-counter platforms, working with players like Aura, for example. But, there are also other kind of ongoing developments focused on cardiovascular health, as well as blood pressure as well. We're seeing Samsung making some moves there as well, working with healthcare organizations there, looking at blood pressure and hypertension management. The second is closed loop systems, right? Focusing on really end-to-end value creation, where devices not only capture value by monitoring, but also guiding treatment, personalizing dosages, and overall just automating workflows. And this adjacency really aligns with the unmet system challenge where, with a massive global burden of disease, which I'll talk about a bit more in a second, where late diagnosis remains the single greatest cost driver. And evidence increasingly shows that AI can improve early detection rates by 20 to 30% and cut diagnostic workload in half. Now, when we look at the global burden of disease, right, through the lens of DALYs, which you see on the vertical axis there. So DALYs basically stands for disability adjusted life years. And it's the years of life that is lost to early death and years lived in poor health, essentially, right? And what you see here is that the greatest health challenges are still dominated by chronic, preventable, and long-term conditions. Cardiovascular diseases alone account for around 428 million DALYs, far outpacing every other category. Of course, you have respiratory infections and TB as well that contribute to another 350 million. Reminding us that infectious diseases remain deeply entrenched, and we had COVID, hit us recently as well, which is still creating some basal challenges, especially in lower income regions. But this is exactly where next generation technologies can move the needle. AI-driven diagnostics can shift detection months, sometimes possibly even years earlier before diseases cascades into a lifelong burden. A point of care sensing brings clinical grade testing directly into community and at home settings, expanding access and accelerating intervention, particularly in regions where hospitals are scarce. And advances in biomaterials can dramatically improve the performance of devices and even drug delivery systems, ensuring that once patients are treated, they stay healthier for longer. In other words, the DALY picture doesn't just show the size of the challenge, it also highlights where innovation can have the greatest impact as well. And finally, this brings us to how companies convert capability into real market opportunity. Many organizations, maybe your organization already have strong internal assets. You have AI teams, sensing platforms, device engineering excellence. But the differentiator now is the ability to align those capabilities with pressing market gaps. And here's an example where AI is making a big impact, right? AI's biggest impact area, according to one study here that looked at over 70 studies, is around areas like risk stratification, early detection, and personalized treatment planning, specifically around increasing, or improving early diagnosis of cancer. Right? You can see that around 40% of these studies point out that cancer is the one that benefits a lot from AI-driven capabilities for clinical prediction, increasing early diagnosis rates by about 20 to 30%. And it also potentially reduces diagnostic workload by about 50%, right? And so, you can see immediately that this enables precise, more personalized therapy decisions that materially improve patient outcomes. Other areas that are also seeing a rapid growth include neurology, cardiology, and orthopedics as well. So to sum up, there are three main key takeaways we'd really like you to take away from this webinar. Now, first, precision AI-driven care has become essentially the battleground for competitive advantage. Every leading company is racing to use data, algorithms, and real-time insights to deliver the right intervention at exactly the right moment. And whoever does that best will define the next decade of healthcare. Second, we're watching healthcare break out of the four walls of the hospital, right? This shift from centralized to distributed care is unmistakable. We've shared some examples with you. It's accelerating fast, and it's becoming the default expectations for patients, providers, and even payers who now assume that high-quality care can and should happen anywhere. And third, the next wave of MDD innovation won't come from building more features. It will come from smartly linking health adjacencies, solving big unmet challenges across the patient journey, and transforming brilliant functionality right into true market opportunity. But that's where the real competitive edge is emerging.
Absolutely. And thanks, Nardev. And so, today that's going to go ahead and conclude our webinar. However, we're really excited about developing our continued research into this space. So if you have any additional points, or if you offered a question today, again, somebody will be in touch very shortly to talk to you about that, and hopefully we can continue the discussion there. Just as an aside, the slide presentation and recording will be made available to all of those, and it'll be sent to all attendees via email today. And then, as always, after leading the webinar, you're going to be prompted to complete a survey on today's presentation. And as always, we appreciate any feedback you may have to help inform and improve any of our future presentations. So with that, I just want to say thank you all for listening, and we're looking forward to talking with you more about the medical devices and diagnostics program moving forward.
Thank you very much.